Many Shades of Pink and Black Health. Many Shades of Pink and Black Health, where good health equals long life. Welcome to the Many Shades of Pink and Black Health radio program on KBOKradio.com, sponsored by Many Shades of Pink. I am your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo.
Well, gosh, I am so happy to be back with my sis. I missed you. Give me a hug.
We've been separated for about the past month.
No, probably for a little over a month. Yeah, so many things have transpired. So many things has happened. We've just been doing so much, and we're just happy to be back together again, and hosting our baby, Many Shades of Pink and Black Health. I kind of little trip there, because I haven't actually had to say Many Shades of Pink and Black Health in quite some time.
When I did the show last week, you were out of town in New York.
Right.
So, and we can talk a little bit about that, but that's part of the reason why. And then in between that, I was on vacation.
Yes.
And so between our two trips, that was really what kind of separated us from doing our regular weekly show together.
Right. So how was your vacation? And you look good. You look refreshed. I need one.
The vacation was great. Went to Hawaii for 10 days, 2 islands, so had a great time.
Okay.
Of course, when you come back, you feel like the vacation isn't long enough because as soon as you come in, you hit the ground running. There's so many things waiting on you.
I know.
During the time that you haven't been present.
Well, you deserve that vacation. I think the last show that I actually did, I actually was like a shout out to you. You was on a much needed vacation, and I'll be glad when mine come around.
Well, you had a little mini trip to New York. Tell us a little bit about that.
Yeah, so I was excited about being a part of Facebook, their social good forum, and I have to tell you that Facebook, they have built a platform that is just, everybody can use it. They're going to have, so they have the charitable cause, and they have waived all the fees. So the GoFundMe account, they're going to be doing Facebook, the charitable causes. So they have that one. They have healthcare. They have the mentorship, where the young youth looking for mentorships, people that can help them. And then they have the crisis. Actually, it's like a button. Like when we go through a crisis, Facebook has the ability to track everything because everybody is on Facebook. I got to meet Mark Zuckerberg, and I know one of our engineers just really wanted me to take a picture with him, but I wasn't able to take a picture with him because they didn't, he didn't have enough time to take a picture with everybody, but I did get a picture of him. So let me just say that I was honored. My picture from the Race from the Cure was actually highlighted, featured, and as well as my video that I did for Facebook. So I was like, wow, we had our own section, where my picture was blowed up, and my video was playing. So, and everybody kept on saying, "Is that you? Is that you? Oh my God, that's you." I was like, "Yeah, that's me." So I felt honored, and not only that, but I also felt honored because they chose me to do on the couch interview at that event. So that was very special, and they gave me a gift for doing that. So
nice.
I was just
you were treated like a princess.
I really was, and had they actually paid for my trip. Got to the airport. I had a chauffeur.
Royalty.
at all.
That
So,
sounded like a mini vacation right there.
Right, and I wish I could have stayed longer,
Mm-hmm.
because they asked me, "Are you going to stay longer?" You know, like it was okay for me to extend my trip over into the weekend because a lot of people did.
Mm-hmm.
But like I said, that was a lifetime amazing event, and I was honored to be invited
That's
as
awesome.
as a guest, and as they showcase. Susan G. Komen, San Diego Race for the Cure 2017.
Right, and that's the reason, that's how you actually got the invitation, because
Yes.
they came there, Facebook was there at the Race for the Cure event.
Right.
And then you happened to meet them, and then that's when they extended that offer to you then, right?
Right. Well, actually, it was two of us that was selected to download the fundraising app onto our Facebook. And when we actually downloaded that fundraiser app, we we knew the features, we knew everything, so they contacted us after we had downloaded that app onto Facebook, and they wanted to do a video. And so we went for the video, and after the video, that's when they was like, "Wow, you're amazing. Would you like to come to our Facebook social good cause forum?" I was like, "Of course." They're like, "That's a no-brainer."
Thank you. Where do I sign up?
Right, where do I sign up? So that was a really good thing, and we have been so busy because the Race for the Cure, that was a amazing event, and it was like one of my first that I was actually able to enjoy myself while I was working. So
right.
yeah.
And it was a full day. I mean, there were thousands of people there, so it
Yeah.
was a lot of fun. But, I mean, we have to kick it back even a little bit further before that, because our event at the City of Hope International, the breast cancer awareness event on October, I believe
That
it was
was
22nd,
amazing.
that was amazing.
That
and it was
really
well
was.
attended. There
Yes.
were over 120 people there.
Exactly.
Yeah.
Over 120 black women in the room at the City of Hope getting educated about their breast health. That was amazing.
And they were entertained with
They sure was.
with my good friend Sherry, an artist, and also her daughter.
Oh, that was amazing.
Yeah.
I love Sherry. I love her.
Yeah, so it was great, and that was the kind of the kickoff for us. That's what really started the whole momentum.
Right.
And then we had the Race for the Cure, and then you had the 3-day after that.
Yes.
And you had the New York thing, promoting more, of the Circle of Promise.
Yes.
And Susan G. Komen, San Diego. So, I mean, it's just been, October started off, and that's where it's been busy for us, and didn't stop after that. So we can take a pause now to catch our breath, because come January 2018, we're starting off again riding our horse.
I know.
Busy
but
as ever.
I'm looking forward to it, and I welcome 2018 being amazing, and big things happening for the both of us.
Yes. So before we take our break, I just want to say that today is what day?
Oh my God, it is my dear sis, big day. This is your day. This is Dr. Susanna Afalo's day, and it was presented to her by Councilwoman Myrtle Cole. So congratulations.
Thank you.
This is your day.
Thank you. I appreciate that. It should be a holiday for everyone so that they can just have the day off. Like
I
a
know.
vacation day, right? Like Martin Luther King Day. But since I don't have that kind of clout, I'm going to read what the last, it has about 1 million whereas on there, as you can see. But the last one, it says, whereas San Diego's own Dr. Suzanne E. Aflalo, remarkable dedication to improve overall health has not only impacted the lives of the patients of Kaiser Permanente, but also the lives of the African American community, medical students, and young people in the San Diego. Now, therefore, be it proclaimed by the Council of the City of San Diego that the Council for and behalf of the people of San Diego does hereby proclaim December 14th, 2015 to be Dr. Suzanne E. Aflalo Day in the City of San Diego. So, San Diegans, from here on out, December 14th, I don't care what day it falls on, you should consider taking it off as a vacation day.
Exactly, but I just want to say this, though, sis. You deserve it.
Thank you.
You have a heart of gold. You have such a good spirit, and I have not met a doctor to date that have the community first interest at heart. I have never met, and I've been around a lot of doctors working at UCSD, and I have never met any doctor that has given to her community. I mean, like I said, your actions speaks volumes on who you are, what you represent, and who you are to the community, you know, and who you have been to me from day one. I mean, I met you over 2 years ago, and I feel like I've been knowing you my whole life. And I just want to say congratulations.
Thank you.
Okay.
Thank you. I so appreciate that. Thank
yeah.
you.
So
I mean,
I'm actually really happy for you, and they you know, it's very well deserved, and it couldn't, you know, happen to the most deserving person. You earned it, and I will next year. We will do something like, you know, we will make that day, really your day.
all right, that sounds good.
I would have done that this time around.
Had you known.
Had I known. I did not know. My sis here, who I work, we are joined at the hip. I didn't know that she had a day. I really didn't. So I'm surprised, but not only surprised, but I am really, really happy for you.
Thank you.
Because I didn't know that this even exists. So
I wouldn't have even brought it up today, but it's like, wait a minute, we're doing our show today, and it's my day. So
yes.
let me let the audience know.
Right, know. And so audience, there you have it. You mark your calendars too, because December 14th is my dear sister's. It's her day. So again, maybe you can take that off next year. And we can have us a little, you know, a little party. We're going to have a powwow for her. And we're going to make it known in San Diego that it's her day.
That's right. That's
okay?
Right. That's right. So we're going to, I want to dive into some really big subjects, but I know we have a little bit of time before our break. So probably the most important thing is maybe just bringing up the main thing that we focus most of our attention on, besides Susan G. Komen and educating our women, is our community event, our community outreach event.
Yes.
And we're going to dive into the details of it, but what I want to do is, before we go on our break, is at least let people know that we're not going to have it in December for a few reasons. Yes. And that is mostly that the location where we normally have our setup at the Big Lots on Federal and Euclid, there's a big Christmas tree lot there. So we could have still had it, but we would have had to park behind the Christmas tree lot, and I don't think we would have been visible enough. No. So rather than have all the, you know, organizations come out and not get the foot traffic that we needed, yes. It's 5 days before Christmas. They would have been on December 20th. We decided to just forego having it this month, give all the organizations a break, yes. Allow them to spend their time with their family, do some last minute Christmas shopping, things like that, and then really come out full force in January when we have our next event, which is Wednesday, January 17th.
Right.
So we'll end up, you know, as we come back from the break in a few minutes, what we're going to do is dive into basically giving some props to the vendors, the organizations that actually are a part of it, our partners, and then letting you know, the community know, that we've had, you know, some additions to the event, so that they can be aware of what services are out there for them.
Right.
And to come on out. We want to spread the word. We want to start early. We want to put it in a newspaper, get the flyers out early so that people can really come out and support it. We do want to make 2018 successful for their health, and we want to be able to keep this, you know, this entity, this whole health hub present for them.
Right, we really do, because the last time I spoke, I was speaking from my heart, because I just been disappointed.
Right. Because
we have not been getting the community support, and so I'm going to be hyped again, starting, you know, January, you know, going into the new year. So, you know, I really, you know, want the community to know that we're here for them, and you know, we created this whole health event for them.
Right.
So,
and to take advantage of the resources that are available to them.
Yeah.
So that's the most important thing. So I think what we'll do is we'll go ahead and take our break now.
Yes.
So you're listening to the Many Shades of Pink and Black Health Radio program on KBLKradio.com, and we'll be right back after this break.
I'm tired of seeing black and brown women dying. They tend to have breast cancer that's more aggressive. They are at a 41% higher risk of mortality because we're identifying breast cancer at a later stage. Komen is here for women of color.
We are providing free mammograms.
It's important that the women of color get their mammograms, get treated, and save their lives. We are more than pink.
Welcome back to the Many Shades of Pink and Black Health radio program on KBOKradio.com, sponsored by Many Shades of Pink. I'm your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo. And before the break, we at least introduced the point that we're, speaking about our community outreach event, our whole health event. We wanted to let the community know that we will not be there in December, on December 20th, strictly because we got booted by the Christmas trees. So they're in our space, right? So the Christmas tree lot is there, so enjoy your Christmas trees. We will be back in full force January 17th, which is the third Wednesday of the month in January 2018, going strong. Mm-hmm. And what we wanted to do was kind of go into, just let the audience know, how many partners we've actually had come on board since we started this back in February of last year. It's almost been a year.
It's almost been a year, because this coming February of 2018 will be a year.
Yes.
So therefore, I think that our list of vendors that have came on board, I think that is just awesome.
Yeah. I mean, and they're really committed. When I go out and speak to some of them, and tell them about what we're doing in the community, they're so excited that they want to come on board. So I'm not even having to twist arms or anything or put a guilt trip on them. All I have to do is tell them about the awesome stuff that we're, providing in the community. And of course, the two main stakeholders are Kaiser Permanente and Susan G. Komen of San Diego Circle of Promise.
Yes.
And of course, with Kaiser Permanente there, in front of the mobile van, that's a 80-foot long mobile van, we have the San Diego Black nurses that are set up there, along with the Concord nursing students that are there, and they're providing the the communities with the blood pressure screening and the diabetes screening. So they're there doing that. The mobile van itself, I'm inside the mobile van seeing Kaiser members on their regular clinic appointments.
But also, for the audience, you don't have to be a Kaiser member. No. We will actually do blood pressures and diabetes checks on everybody that comes.
Yeah, so that's this entire community outreach event is for the entire community.
Right.
The whole reason why Kaiser's van is there so that I can see Kaiser members, but I still see non-members on the van if they find out, if the nurses and the students find someone that has an elevated blood pressure or a sugar that they've tested outside of the van, in front of the van, and it's elevated. I will counsel the person inside the mobile van, trying to find out if they have a history of high blood pressure or diabetes, and trying to get them on track and be able to hand them off to someone that can follow up on that.
Right, like basically trying to, if they don't have a family home, we can try to, recommend a family home to them.
Right.
So,
and we have a list of resources of all the community clinics there in the entire San Diego County. So North County, East County, South Bay, and Central. Yes. So we have that. So if we find out from this person that they do not have a physician or a provider, then we can provide that to them and make sure that they get seen right away. And on top of that, and we'll go into that, but in the parking lot, there's Family Health Center speaking about their health insurance, and there's San Ysidro there and things like that. So there are health centers there that can speak about having them come on board in a prorated rate, where if they don't have insurance, they can pay a small fee depending on how much they earn.
But we also have one of our vendors there that can help them apply for health insurance. So if they don't have health insurance, we have people that's there to
help them sign up.
Actually give them knowledge, access, and help them fill out the paperwork.
Right.
So,
so going down the list, we have to give a shout out to Big Lots first and foremost.
Yes.
I mean, we Komen and San Diego, which is really you and I.
Right.
You and I came up with the idea to do this community outreach event, and then once we went to our our counterparts, you know, in terms of saying, hey, can we get the van out? Because
Right.
it's our brainchild, but we had to get buy-in from these large organizations.
It's our baby.
Right.
It's
right.
it's
So
our
don't
baby.
Get it twisted
don't
out
get
there.
it twisted out there, okay? Because this is what we came up
Right,
with.
right.
You know, my sister and us.
Right.
You know, we basically had the idea, the concept, and she took it to Kaiser, I took it to Coleman.
Right.
So.
And with that, so then
yeah.
we also got permission to be on the Big Lots premises free of charge, which is awesome.
I mean, not only that, but we just bullied our way on into Big Lots.
We just drove the mobile van on their parking. No, we got permission.
We got permission to go on there, but they have been so awesome.
Yeah,
they really have.
A special shout out to Mr. Ken Garcia, the manager, and Brandon, the assistant manager out there at Big Lots. They have been so welcoming and so excited to have us there. They look forward to having us there every single month. They allow their employees to come out and participate by getting their vaccines and things like that.
Mammograms and everything. Yes.
So that's the most important thing. And on top of that, the manager started offering us cases of water for the people that come through free of charge. And so I wanted to kind of bless him back. And so I said, well, do you mind, if I create something to kind of bring foot traffic into your store? And he said, yeah, I'll be willing to offer 10%. So what I did was create this Big Lots 10% discount card. Right?
We got our own Big Lot card, okay?
So what happens is, so when people come through and get their blood pressure checked, diabetes screening, and some other things done, if they visit at least 4 or 5 vendors at the Big Lots, then we give them this on top of some of our other gifts that we'll talk about later. But this goes in our gift bag, so then they can just take this, walk right into Big Lots, go shopping and get 10%. Present this beautiful card that we drafted, and get their 10% off of anything they want to purchase. So I have to, say thank you to Big Lots, especially Mr. Ken and Brandon for basically allowing us to be there every single month to serve the community and to serve their employees also. And then, of course, we cannot forget KBLKradio.com and KK, Jazz, KKSD Jazz radio station, Mr. Tayati and all the crew.
Well, we have to give the crew a shout out.
A special crew. Mr. Melvin, Mr. Fahim, Mr. Al. We're going to have to do Al separate. But I mean, all 3 of them, especially Mr. Tayati, so all 4 of them as the 4 men in our life that keep us strong and challenge us too. That they have just been very supportive in the whole vision of this and helped to carry this through. So they help promote it, on the radio by giving us airtime for PSAs, the advertisements and things like that, being out there, helping us pass out flyers, and having him here in the radio station, but mostly from Miss Big Al, that he comes out and give us free, music out there.
The monthly event.
Yeah, at the monthly event. So we have to thank all 4 gentlemen for being supportive of our vision and helping us carry it out each month. So that, of course, is...
So I'm going to do it again. A big shout out to you gentlemen. You guys have been... the center of our mission this whole year. So again, we
kudos to you.
Yeah.
And even though we may be challenging at times, thank you for being patient with us.
We just we're women on the move. We have a vision, we have a mission, and we just trying to make sure that vision, everything that we want, it goes through, and we're making it happen.
Yeah, and to be honest with you, even though we claim it, we already know that it was put into our existence through God, that He put that in our heart.
He did.
To come together and to bring something out there. So the number one thing is thanking the Lord for just for giving us the idea, and number 1 for trusting us with it.
I know.
Because He knows we're going to carry through. He knows that we're committed, we're dedicated, we're not quitters.
Right.
We're, passionate about Him and His calling. We're passionate about His people.
Yes.
And so, therefore, that's why we have this motivation to go out there and make sure we make it successful, make Him proud of us, and then make sure the people that His people are served. So I got to put a plug in for the big man up there.
Oh, we have to. And not only that, but the thing of it is that this is our assignment, and we have answered to our assignment, and we say yes.
Yes. Thank you. Yes, with pleasure.
Exactly.
So going down the list, we've already mentioned the San Diego Black nurses and
Yes.
the Concord nursing students who are out there. They usually come out about 10 deep.
Yes.
And they're learning their craft, but they're so good at, you know, the patient interaction or their client interaction. So they're really good about welcoming the people that pass by to their tables to make sure and make them feel welcome in getting their blood pressure and getting that little finger stick to get their blood sugar testing done.
Yeah, they're amazing.
Yeah, they are. And then, of course, probably the longest and committed vendor out there is San Ysidro Health Clinic. Dennis, a shout out to Dennis.
A shout out to
Vega,
big shout out to Dennis.
He brings the HIV testing, the mobile van out every single month, and we appreciate that. And we'll go through the numbers as to how we do our screening and how many people have been coming through, but he's been really a cornerstone in that. And the same thing with Family Health Center. Yeah. Michael has been good.
Michael.
They speak about the health insurance in general. They also provide someone from Family Health Center that does the breast health education. They come over towards your mobile van and help to educate the women while they're sitting there doing their paperwork and things like that.
Right, they're one of our grantees.
So that's fabulous.
And so that's fabulous. That worked out. That worked out great.
Yeah, that's
because
perfect.
While they're waiting, they actually can get educated on breast health.
Yeah.
So that's awesome.
And then one of the newer kids on the block, which is still from Family Health Center, is the Hepatitis C mobile van. They've been coming out.
Let me just tell you that right there, we was blessed with that.
Yes.
Especially with the situation going on downtown.
Yeah.
We were blessed with that.
So we're doing hepatitis C testing. We are in a location that has a slightly higher risk population. We do have a clinic here where there's a lot of people coming through to get their attention, their health attention focused on. Yes. And so we have people that are uninsured, underinsured, and even homeless, and they pass through the Big Lots shopping center as they go to this specific clinic to get their needs met. And so that's a high risk population that the hepatitis C and the HIV testing is so important.
Yes.
So I'm glad they came on board. And then also the county.
Yes.
We were able for the last 2 months to get the county come out, and they're actually providing the hepatitis A vaccines due to the epidemic that started downtown and has moved into all kinds of cities. But the hepatitis A vaccines and the flu vaccines.
So that's
the flu season.
So actually, the Hep A is what is going on downtown.
That's the epidemic that started in the homeless population.
Yes.
Mostly because, you know, and I don't want to get into a lot of details, but the transmission is fecal oral. So it has to do with, you know, stooling and then not having anywhere to wash your hands, and then you handle your food and then you pass that on into your system. So it's a fecal oral transmission, and what's happening is the homeless have nowhere to go and take care of their personal needs, and then they have nowhere to go to wash their hands and clean up. And that's kind of where the hepatitis A epidemic started in that population and has spread, because as the city has, you know, decided they want to wash down the sidewalks and everything and try to get rid of the Hep A epidemic with the virus, they've also pushed the homeless population from the downtown area out into all the communities. Up into Hillcrest, Bankers Hill, East County, South Bay, and so they're not just in Balboa. They do need some place to be, and since they've chased them out of the downtown area for a while to kind of get control of the hepatitis A epidemic, they've now spread the epidemic. Anyone knows
they have spread it. They have actually, instead of them just maintaining it and keep them where they're at, they have pushed them out into the community. So guess what? It's spreading.
And the community's at risk, and that's why we're there helping to at least try to protect the community out there to come out and get your hepatitis A vaccines, because you just don't know if you're at risk or not, and it's better to be safe than sorry. So that's the county, and they're coming out, and they'll continue to come out and help us by providing the Hep A and the flu vaccines. This is cold and flu season. So
it is, so thank you, the county. You know what, I spoke with them the last time they were there in November, and they were awesome. They basically were so excited to be there. And they want to be there.
They want to serve the community. And this is a good location for everyone to be there one-stop shopping, that health hub, that whole health approach. Get your vaccines, get your mammogram, get your blood pressure, diabetes, whatever it is you need.
Yes.
And we'll go through the rest of the list to tell you that there's other services available, so come out.
Yes.
We have a couple new ones, and we'll still go with the other ones we have, but I want to mention a couple of the new ones. The Nasa La Maestra Clinic has confirmed that they will come out starting in January with dental screening. So they actually have a mobile van that they can bring out, and they can do dental screening.
Remember when we saw that at, what was it, Brother Roosevelt's event, and I was like, hey, they have a dental clinic. And so I'm so glad that you made contact with them, because that is so important. Our dental health is very, very important, that I think that the community has lacked. And they're not educated on their dental health, and don't realize that their dental health is so important that it impacts their overall health.
Yeah, oral health is key. I mean, if you have abscesses and periodontal disease and gingivitis and all kinds of other things that's going on in your mouth, that will affect your heart. It'll affect the rest of your organs, and so it's important that our oral health is well maintained, and that is to obviously get screening and then have things taken care of. And so I will let you know that they will also do full dental exams starting probably in February. We'll do the screening in January. We'll get a sign up for appointments, because what will happen is come February, if they can get 25 appointments, they'll bring their dentist out on the mobile van to do full exams.
So we need to be signing up people for so that we can make sure that they dentists come out in February.
Yeah. Well, I will have my own dentist coming out in February to do some other things, but the mobile van will La Maestra will bring their dentist out once they have appointments, because they can't bring the dentist out to sit there. So if they have appointments, he or she can come out on the mobile van.
I'm loving this.
And then they have full exams, so you can get screening. Screening's open to everyone.
Yes.
The full dental exam with x-rays can be done on the mobile van by the dentist, and it's free for Medi-Cal, it's free for women that are pregnant, and it's free for children 5 and under. And then people that are uninsured, it's only going to be a $49 fee for that whole thing.
Do y'all hear that, audience? Do you hear this? Okay. $49. Okay, so
full exam,
yes,
x-rays, and then you get a basic cleaning of your teeth. The cleaning isn't done on the mobile van. You will get a follow-up appointment at any of the La Maestra clinics that does it. But for your $49 promotional thing, you'll get full exam, x-rays, and a basic dental screening. If you need deep cleaning, that might cost extra, but basic cleaning, all that's included in the $49.
Oh, okay.
So that's amazing. That's going to be with appointment. But everyone else, if they don't want that, they just want a screening, it's open to everyone for screening. That's free. They'll provide them toothpaste and toothbrush and some other things too.
All right. Yeah. So we have to get the word out on that. So audience, if you haven't been to the dentist, hey, come on by, swing on by.
Get your grill checked.
Exactly.
So we have a few more people we want to mention too. Think Dignity is an organization. I just met one of the young ladies that work with them. They actually serve the homeless population, and tomorrow we have a site visit out here at the Big Lots parking lot. We just need to check 3 things before we can have them committed. But if the setup is here and ready for them with water access and electricity access, then what we can do is provide free showers to the homeless population.
Wow,
here.
That's awesome.
Yeah, so we're going to have that out, and I will know more about that after tomorrow when we do the site visit on the actual parking lot site. So we're looking forward to that.
What is that young lady's name?
Her name is, I will tell you, Kaylin.
Kaylin.
Yeah. And so once I meet with them, she and her supervisor tomorrow, I'll be able to make sure that we commit and get that listed on our flyers and everything else that we're promoting.
Okay.
So we also have, obviously, one of our partners from the very beginning is the American Heart Association.
Yes.
They have been, supporting us. They also come out, their volunteers come out and speak about healthy eating. They've even done hands-on CPR lessons.
Yes, they have.
And various things. But they also support us in allowing funding for us to print our flyers and get that out there.
They have.
And providing us the funding to get our ads in the newspaper. So we have to make sure we give a shout out to the American Heart Association.
Right, and they have been awesome. So
Yeah.
big shout out to American Heart Association. Thank you.
Yeah, Neighborhood House, they're here quarterly.
Yes.
You know, and so they come, they have like 8 to 10 services. So
Yes.
they come out and they rotate, they have their managers come out and speak about, you know, two of the events like everyone. So they have at least 8. I think they have things like, you know, Black Infants Health. They've got some mental health, senior services, adult daycare services. They've got early childhood and youth development, all kinds of wonderful programs.
Wonderful.
And so they're here at their booth sharing with the community what types of things they have available to the community.
So big shout out to Neighborhood House.
Neighborhood House.
Thank you.
Homestart has been here every month.
Yes.
They're the ones that can help people sign up with for CalFresh to help
yep.
with getting food stamps and things like that. They can sign you up for Medicare if you're eligible for that. Employment support. They also will help you with your resume and things like that. So they're very supportive. Mental Health America is usually in the house, and they have they provide the education and services for mental health in the community. UCSD and the county, they've been good about giving us donations. So all the cookbooks we've been giving out, and the T-shirts and some of the shopping lists and the recipe cards, those are coming from the county.
I really love that because I have actually made a few recipes. I actually cooked a few recipes from that book. Okay. Oh my God. Yeah. I'm like, I like it because it's simple.
Yeah.
And also I sent one to my daughter for, you know, it's the simplicity that we need.
And they have 3 different cookbooks. So they have that soul food cookbook, and they have some other healthy recipes and things. So anything out there for anyone. Multicultural Health Foundation, they send their nurse practitioner, Nancy Jackson, over. She does a in-home program where she visits the patients for 4 visits once a week to help get their blood pressure under control. And that's a program that they have over at Multicultural Foundation.
And she was our guest.
Yes.
She was our guest was it 2 weeks ago?
Was it?
Yes.
So, and she spoke a little bit about the program.
Yes.
There's a couple other new vendors that should be coming out. The California Telephone Access Program, they're going to come out and speak about the free programs that they can provide for the deaf and the disabled people. That
that's awesome.
Yeah, you know, special phones for them, that's free.
Yeah.
Rescue Mission wants to come out. They're excited to come out starting in January to speak about the programs they have for the homeless women and children.
And the Rescue Mission, I think I met her at Black Girls Rock.
Miss Diane Yarborough.
Okay,
that's her.
So her daughter is Rachel?
Yes.
Okay.
The one that did the MC.
Yeah.
For the gala, for the fashion show.
Fashion show.
Yes.
Okay.
So that's her.
That's her. So
that's how I nabbed her.
Okay, because she said that. I think we need to have her on the show. She was interested in coming on the show.
We can sign her up for the show for sure.
Yeah.
Yeah. And we also have Mr. Lester McCurtis, who's going to come out. He's come out several times to speak about holistic health.
Yes.
We have World Finance Group. Ewing is his last name, and Adrian Ewing, and he speaks about financial education and insurance. So, you know, we try to get anything related to your health, mental health, spiritual health, physical health, financial health, whatever it is, related to you being well, that's what we're there for. And so I'm still working on a few future partners, and that is Feeding San Diego. I've gone over to their warehouse and spoke to the CEO, Mr. Vince Hall. And so I'm in connection with them. Hopefully I can get the paperwork done and have them out here in January. That's my hope.
Okay.
Still working on vision screening, working through either the Lions Club or the Kiwanis Club to see if I can get them to organize that. And then also trying to do colorectal screening because, you know, people die from colorectal cancer. My brother died at 39 of colorectal cancer.
Well, not only that, but that's one of the cancers to me is just not spoke about.
Yeah.
You know, we don't.
And it's easy enough to screen.
Yes.
So we're trying to get that out in UCSD and SDSU's public health department. I'm working with them to see if we can get them out to come and speak about the test. It's a simple stool test, and they can speak about it, and they will track them and follow them through if there's anyone that comes up positive. Yes. So that's on the horizon. Those are the vendors and the organizations that are participating in there, and we just want to give a quick kind of a summary on what we've been doing. over the past several months. We've had, turnout depends on the day, the time of day, the heat, the weather, whatever it is. So we've had anything from
the community
support.
Okay, so I got to throw that out there.
Yeah, whether they're complacent or lackadaisical, or whether they're energized. But we've had anything from, I'll say about 30 on the lower end to probably about 100 or so on the higher end, with an average about 60 to 70 people coming out that we service on any given event each month. So we're hoping I'd love to see at least 100 come out every month.
Every month.
Yeah, that would be my goal.
Yes.
But so it's coming along. We're excited about it. We have a survey that we ask people to fill out.
Yes.
And what happens is, they tell us how they found out about the event, but they also let us know what other services they'd like out there. So they always mention dental, vision, and food distribution. So that's why I've focused on those three. And we have one, and hopefully I'll get both of those two before January.
Yes.
Yeah, so that's kind of the summary on that. We're hoping to see people out there.
I am really excited for all the services that we have to offer the community, and just to let you guys know, we chose to service the underserved community. So this is one of the reasons why we're here. We wanted to create a whole health approach in this community, as Sis here said, a one-stop shop for all your health needs. So again, we're doing our part. We need you guys to do your part by showing the support. If you don't need the services, pass the word to your neighbor, your family, your friends, that I know someone that needs some kind of service. So spread the word and let them know what we're doing and what we're offering.
That's good. So now it's time to talk about this book and your chapter.
Yes.
Tell us about it.
Yes. So I am going to be a co-author in Open Your Gifts book 2 with Kim Coles. And I have to say that I'm honored to be one of the co-authors, and what I'm speaking about, I have so much that I could share, and Kim Coles has touched on a lot of things that we have been through in our life. They could be gifts to help other people. And so I have had so much going on, in my life, so many tragedies, and those tragedies have actually led me to helping others and wanting to help others. And as they say, as you're going through that storm, as you're going through that journey, you really don't know that God is actually working with you. He already knows. He already knows what He wants for your life and what He intends for your life. But while you're going through it, you just absolutely don't have a clue. You're constantly asking yourself, what do you want me to do?
Right.
I don't get it. And a lot of things, you're not supposed to get, because He actually puts you where He wants you to be. He places you there, and if He doesn't place you there, He sends everybody, to be around you, what He wants you to do. So it's not about what you want to do in your life. It is what God wants you to do. And so that's what I kind of talk about in my chapter. And my chapter is called Shattered into Your Purpose, because I had to go through everything that I actually went through to have my purpose. I never knew my purpose, but I do now.
Yes.
So I am so honored. I can't wait for the book to come out. And you guys, when this book come out, Open Your Gifts 2, you make sure that you actually purchase them from me. Okay?
And we need to give a shout out to Kim Coles for the ones that may not remember. I mean, she was a star on Different World and in Living Color. So Huh? Different stroke? No.
No. It's actually living single.
Oh, living single. That's
yes,
right. Living single.
It's a living single and in living color.
And in living color.
Yes.
Okay.
Mm-hmm.
All right. So my bad. So just in case, because for you youngsters that may not even watch those shows, because that was 20 plus years ago, that I'm sure they're still running some.
Yeah, they still
some reruns on some
well,
channels.
I know I still watch Living Single because that was one of my one of my shows, one of my favorite shows, and in Living Color, I haven't actually seen too much.
Yeah, there were a lot of skits on in Living Color.
Yeah,
in Living Color, there were a lot of skits with the Wayans brothers and things like that. Yeah, so she popped up in a lot of skits.
Well, I'm actually happy and blessed that and that's the event that I did not want to go to really, and I actually tagged along with you. You was like, I bought your ticket already, you gotta go.
That was 2 months ago.
Yes.
Well, that was about a month ago. We went to that event, we met her, we purchased her book.
Yes.
And then that's when you got invited to be an author, and then you and the other 21 co-authors were able to be on a platform at this last event about 2 weeks ago.
Exactly.
Where you could get up and speak a little bit about your experience, and then what your chapter is going to be on.
Right.
Yeah. So we've been around Kim Cole's presence 2 months in a row.
Exactly, and I've actually been speaking with her on the phone. So
yeah. And Mr. Melvin Graham had an opportunity to interview her right before her last event, which was about 2 weeks ago, right?
Yeah. About 2 weeks ago, and he, thank you for giving me that shout out. On there, so I was, had a shout out.
Miss Wendy Sherrills from Many Shades of Pink and Black Health.
Exactly.
Yeah. That was cool. We got some free advertisement on that one.
Exactly. You want to talk about our community event that is
So I think what we're going to end up doing is for our next event in January, the community outreach event, we're going to just really push to get it in the newspaper, get flyers out early, do our PSAs on the radio station, send out emails, put it on Facebook, and just really try to do a blast of our next event. So, and hopefully we'll have media out there so we can really put ourselves back on the map for January 2018.
Yeah, we're going to bring the new year in with good health
equals long life.
Equal long life, okay? So also I just wanted to mention, save the date for February 24th at 10:30 is going to be Coleman San Diego Circle of Promise Survivors Fashion Show at AMN Healthcare. I think that is in Del Mar. I'll give you guys more details as we get closer to the event.
Is that the Marriott?
Well, it's next to the Marriott,
okay.
Del Mar Marriott. So I'm very, very excited about this because I've been wanting to do this for a long time. So big shout out.
Yeah.
So you guys save that date, February 24th at 10:30. Mark your calendar and make sure you're there.
Yeah, and I think the other things that we can start mentioning. I mean, obviously, I helped to run the health and wellness ministry over at the Church of City of Hope International Church. And so our focus is going to be 3 main health events this year.
Okay.
The 3 are going to be... Yeah, I do. February 10th is a Saturday, and I'm going to be partnering with Nasara, our fitness champion out there. And we're going to do probably a rebirth in wellness again, part 2. We did it last year. It was a success. It was over 100 people there. Lots of vendors related to health. And so we're going to do another one. This one's going to be focused on heart health.
Okay.
And Black History Month.
Am I invited?
Of course. Everyone. The whole community is invited. It's a free event. We're going to even feed you. So maybe that's what will get people out there.
Well, maybe I need to be a vendor.
Well, you can be a vendor.
Yeah.
You can be a vendor. So we're going to have, so that'll be one. I'm thinking, we haven't confirmed the exact time, but we're looking at probably a 10 to 2 type of thing. We'll have a brief presentation on heart health, the importance of keeping things under control in your health, blood pressure, diabetes, weight, things like that, cholesterol, so that you decrease your risk for stroke and heart attack. So that's Heart Health Month, February, and Black History Month. That's why we're doing it in February.
Right, and so that's why I'm doing the Survivor
the
Fashion Show for the Black History Month.
So both of those events will be there on February 10th and February 24th.
Yes.
And then our other two events at the church, and we'll give you more details as it comes along. June 10th, we're going to do a men's health event, and that's going to focus on men's health, prostate cancer, testicular cancer, just, you know, all kinds of things related to men. We'll keep the women out the room so you guys can have a, you know, heart-to-heart, man-to-man conversation.
Yeah, because we know that you guys are, you know, shy about speaking about, you know, certain things, okay? So, you know, we're going to make sure you have your privacy.
Yeah, I'll make sure that we bring some male physicians there so I don't have to be there talking about, you know, prostate cancer to a room full of men.
Right.
Although I'm well-versed, I think you guys will receive the message better if it's a male provider, so I will look into that. So that's going to be June. We're going to focus on our men and their health. June 10th. That's a Saturday. Mm-hmm. No, that's a Sunday, I believe.
That's a Sunday?
Yeah, that's a Sunday. The first one's a Saturday. And then the last one's going to be October 21st. That's also a Sunday. And it's going to be like a part 2 of our breast cancer awareness.
Yes.
We'll be, you know, doing some entertainment and things like that, but we're focusing on women's health.
Yes.
And also breast cancer. So we may speak about cervical cancer.
Yeah.
You know, not only breast cancer, but all kinds of other things. The importance of getting your regular screening, your health evaluations, your pap smears, your, you know, for your cervical, to rule out cervical cancer, and all the other things that are necessary for women to keep their health up.
Yeah, but our main focus will be the breast,
yes.
But we're going to throw that all that other, that, you know, that basically the women actually experience, and
right,
especially cervical cancer.
Right. It's more prevalent than you realize. So
yes.
that's why we chose June
yes.
for the men's health, because that is Men's Health Month, and then
yes.
October for women's health, because that's Breast Cancer Awareness Month. Right. So we want to focus on those. Those are our 3 main events coming from, you know, City of Hope International, from our health and wellness team. Oh yeah. And thanks, team, for keeping me going.
And I really like them. So shout out is to the WOW.
Yeah, exactly.
The WOW.
Yeah. women of worship. Yeah. Yes. So yeah, the teams, the ministry teams over there really work well together. We're going to work with the men's ministry team for the Men's Health Project. It's open to the entire community. We want to at least get 100 people out there. We're going to feed them in each event. We'll
make sure that all 3 of those events are successful, including our February 24th event. So
we have 4 events coming up that we'll continue to speak about. We'll get flyers out there. We'll put it on Facebook and email it out to some people that don't do Facebook. And,
or social media, period.
Yeah, because I don't know anything about Instagram or Twitter, so whoever knows that, you can work on those.
I will.
Yeah. So I'm trying to think if there's anything else that's coming up in the near future that we need to mention before we get off the air.
I don't think so.
I think those are the main things. I mean, next week we'll be on there. I do believe I have my nephew that's been confirmed to come on next week. Adam Aflalo, he's a new grad of a physician assistant, so we'll be able to pick his brain. So he's coming next week. I'm excited about that. About time I bring a little family up in here.
Right, and glad to have him.
Yeah, I don't know if you can handle 2 Aflalos in the room, though.
Oh, I think I can. We're going to put him in the middle. I don't know if he can handle me.
Oh, no, I don't think he can. I don't think he can. He's going to blush. His dimples are going to show. It's going to be funny. But no, I'm excited to have him on board to just speak about his journey and what he's done. He's had a tough life himself, but you know, I raised him from the age of 8, so you know it's been a blessing. And I did not ask him to go into medicine, but his calling is medicine, so he can tell you about that journey. So I'm excited about that. And I think we've pretty much exhausted our time today.
Yeah. So go ahead.
So you've been listening to the Many Shades of Pink and Black Health Radio. Sponsored by Many Shades of Pink on KBLKradio.com. And
I am your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Aflalo. It's been a pleasure just sharing so much with you guys today. Thank you so much for listening. Remember to stay tuned every Sunday at 2 p.m.
And for more information on breast cancer, visit the Komen San Diego Circle of Promise website at www.KomenSanDiego.org.
And if you want to learn more about A Healthier Me, my program, a lifestyle change program, go to www.ahealthiermesd.com.
Bye-bye.